We have a higher than average suicide rate in Carleton County and in the region. We've had a lot of attempts at trying to stem that, lower the suicide rate. We were not getting the job done. So we ended up pulling together a small group of people to really look at some non-traditional ways. One thing we found is that right before kids were making the lethal decision, they were either on Facebook, they were texting, they were somewhere not talking to adults.
We really wanted to meet kids where they were at, and kids were texting, and so we knew that that was somewhere that we needed to go technology-wise. So TXT4LIFE is an actual texting service that kids can use to get connected to a mental health professional, and what we do is do a lot of outreach around that text messaging program.
When somebody decides that they want to use TXT4LIFE, what they do is they'll take out their cell phone and they'll put in the 6-digit number, which is 839-863, into their to box, and then they just write the word life. That's all they have to write the first time and send it. And that connects them to our call center, text center in Richfield, Minnesota.
When a texter texts into the suicide hotline or the TXT4LIFE line, they're going to get an automated response, immediately followed by one of the counselors who will respond to them with, "Hello, my name is so-and-so, and how can I help you?" At that point, we're going to have a discussion and try to find out what brought them to the texting process, and then work with them on that and hopefully work towards some type of referral or connection for a resource in their own community.
There are traditional mental health services available. There's school-linked mental health services available. Kids are not accessing those in high enough numbers. So the goal here is just to get the kids connect somehow, slow things down, get a sense of where kids need to go so that we can refer those kids via the texting conversation to someone that they trust in their school, community, or mental health center.
I started using TXT4LIFE probably in 9th grade because I would say that was like the worst time for my depression. I saw the TXT4LIFE posters on the school walls and I thought maybe that would help just because they wouldn't view me as an outsider. They'd talk to me and that's all I kind of really needed. Seeing somebody face to face or even hearing somebody's voice is kind of difficult just because it kind of makes you want to stop talking to them about something so personal, but when you're texting, you don't have to look them in the eye, you don't have to like hear them say these things, and you don't have to actually physically talk to them. You don't have to say it, you can just write it down. It's almost like a journal that you kind of push towards someone else.
The way that TXT4LIFE has been successful is really spreading the word, and the way that we've done that is giving school presentations, giving them a brief education on suicide and how to help a friend, but then also giving them the text number and actually having them enter it into their phones so that, you know, even if they don't use it, it's a resource in their pocket to give to somebody else, or if they do need it, they can pull it right out. Also, we really want to make sure that there's people in the community who are trained to be able to feel comfortable talking to somebody who's in a suicidal crisis. So we have offered a couple different trainings, QPR, which is question, persuade, refer, and ASSIST, which is applied suicide intervention skills training.
I went through the student training for TXT4LIFE, and it motivated me to be in TXT4LIFE and like started kind of our little group in our school.
With a lot of the bullying and cyberbullying, it's good to focus on ways to get help using your cell phones because people think that there's no one there to help them. So it's good to raise that awareness.
I feel like the TXT4LIFE program and the TXT4LIFE group has made this a safer place for everyone who's here to know they have someone that they can turn to.